Welcome back. The Civic Center Pharmacy specializes in compound medicine, and joining me is Tanil. I know I was going to say this.
That's okay.
Tanil Davis and
Davis.
Dr. Massengill with us. And so, how are you two doing?
Doing well. How are you today?
So good. And we should be, pretty much knowing each other on a first name basis. We've been here enough with us, giving us information on, of course, compound medicine.
Yep.
But it's very important now to talk about the hormone therapy compound medicine, and tell people a little bit about what that is.
Sure. So compounding is the art and science of mixing medications for patients based on a doctor's prescription. So unlike going to a regular pharmacy where pills are poured from one big bottle to a smaller bottle, we're actually mixing things up from scratch. Yeah. One of the most common types of compounded medication that we dispense is hormone replacement therapy. There are a lot of patients that as they go through menopause or andropause, which is the change for men as well, they need support in their hormones. Not all commercially available hormones are appropriate for all patients, and so many patients are prescribed custom compounded hormone replacement therapy.
Which are very important. You said something, again, very important about the men. We don't really hear about men and hormone therapy we should. We always hear about the women.
Yeah, most of us think about just women for hormone replacement therapy, but we prescribe and dispense just as many hormones for men as for women.
So, and doctor, let's talk about that and what that hormone therapy is for people to understand a little bit more.
Sure. So when women go through different changes of life, we always think of menopause being with the vasomotor symptoms like hot flashes, night sweats, or the genitourinary symptoms being painful intercourse, that sort of thing. But that also happens, during other phases of life. So hormone therapy isn't just for menopausal women. And like Tanil said, hormone therapy can also be very powerful and important for men going through andropause. You can see declines in libido, declines in energy, declines in mental cognition, mental clarity, that sort of stuff.
Yeah, what's very important. What's also going on too that we need to address, and that is where this might be taken away if we're not pretty much out there talking about it, letting people know. Let's talk a little about that.
Sure. So many patients use compounded hormone replacement therapy. And what many patients don't know is the FDA has indicated that it intends to limit or restrict access to compounded hormone therapy. Because compounded medications are all individualized, we can't have randomized, placebo-controlled clinical trials because each one is individual.
Right.
Because the FDA essentially commissioned a study to look at hormones and how safe and effective they were, but they didn't have any studies to evaluate, so the commission that they hired basically said we can't say that they're safe and effective.
Right.
But we know that so many patients benefit from them.
Exactly. And I think the other thing people have to understand is that you know at being a compound what goes in there, and as you just said it, we have to say there may be under short staff. Maybe they don't understand what's going on, so they're kind of like just saying, okay, well, let's just get rid of it and not even go look at it, not even talk to people, talk to the doctors about how important this is. And that's what we need people to start realizing, especially those that need the hormone therapy compound. And doctor, you come on and we're talking about this because we want to make more people aware, because maybe you don't need it now, but you might need it down the line, and if it's not there, it's going to be hurting a lot of people.
Absolutely. So one of the big ones that is under threat right now is estriol. So there are actually 3 different types of estrogen that are important in the body. Estriol is E3. There is no commercially available form of that estrogen. It's very important for the symptoms that I was talking about previously, the hot flashes, night sweats, vaginal atrophy, which leads to painful intercourse. And it actually comes with less risk of estrogen-sensitive cancers, which is a big concern when you're looking at different hormone therapies for individuals.
Yeah, but need it. And that's where, Tanil, you guys come in. You guys are trained there. I think some people, when they think of compound, they think, oh, it must be witchcraft. It's not. And that's one thing we got to make sure people understand that. Because, again, you're there to help people take the right amount of medicine they need, but in a form that's easy for them to take. I mean, I know we've talked off camera about, it's amazing the number of people that can't swallow pills that come to you because of that reason. It's just something with them they can't do. And you've helped people, you've saved lives, and that's important there to know.
Oh yeah, Yeah, we feel, doctors decide what therapy is appropriate for patients, and we make those custom medications for patients, solving that need. And what we need patients to do right now, especially patients that are on compounded hormones and want to preserve access to them, is to go to compounding.com and upload their stories. So if you go to that website, you can upload your experience with compounded hormones. Because we don't have these big clinical trials to show the FDA, what we do have are patient-reported outcomes, patient stories. Right. So that's what we're trying to gather the most of, so we can show how necessary this therapy is.
Very important. Tell them the website again.
Compounding.com.
Okay, make sure you go there. And then also what they like to do is have you head over to another website to win your chance at a women's hormone book. This is very important for people to have, isn't it?
Yeah, so this is a new book that came out by Dr. Pam Smith, and if you go to our Facebook page, you can enter a drawing to win a free copy of this book to learn all about women's hormones.
Thank you. And the Facebook is?
Civic Center Pharmacy's Facebook page.
It's right there. So thank you to them. Thank you, doctor, for coming in. And again, if you're out there and you want more information, we'll have it on aztv.com. But please go over to the Civic Center Pharmacy, and they're there to help you in every way. All right, come on back. We got more Mix right after this.